Hopefully you can see my screen, right?
Perfect. Thank you very much.
Thank you very much. Yeah.
So thank you. I thank Theo and the whole team for inviting me to this workshop and the opportunity for sharing today. I will quite quickly introduce you to an ongoing initiative in Italy, which is in a sense broader in terms of aim and reach with respect to the area of physical activity and healthy aging. Still, I believe, and we believe, relevant to the field. I'm indeed going to present you what we are doing within this national flagship initiative, which is named DARE, Digital Lifelong Prevention, which is an initiative funded by the Italian Ministry of University and Research for 4 years, still with the expected extension of the funding so far through 2028. It's national co-funding to the next generation EU investment, specifically supporting research initiatives for innovative technologies and pathways in the health and care sector. So really looking for last mile solution. So something that, of course, is generated mostly within the research community, but that is ready or mature enough to at least engage with the translational process with a clear horizon, also in terms of possible impact on the society and the economic system. And our focus is on the valorization of health data, and we've been funded and we've established a public-private partnership, which is led by the University of Bologna, with a focus on data, as I said, and more specifically on how we can leverage on digital solutions, but also with a very specific focus, which is on prevention. And so you see that we are getting closer and closer in a way to the physical activity and healthy aging area. So it's not digital health, broad scopus, but it's really just focusing mostly on prevention, digital prevention, actually spanning the whole range of prevention from primary to tertiary prevention. And having established a national community in Italy with key partners mostly concentrated in 5 regions from north to south of the country, but then throughout the cascade funding mechanisms have expanded to 8 more regions, as you see from the map. Including universities, but also research hospitals, local health authorities, research centers and companies and NGOs, as well as environmental agencies. So we have established a consortium with 27 partners, and we are in a phase in which we have opened the possibility to broaden this further at the national level. So, but why the focus on prevention? Basically, we wanted to take the opportunity to answer to this important investment on public funding, trying to address a key issue, a topic that is clearly recognized by all European stakeholders. And indeed, if you look at official policy documents, policy briefs, ranging from G7, recent G7 Health held in Italy last year, to the inaugural speech from Prime Minister Starmer in UK, to a bunch of work from OECD. Well, the focus on prevention is pretty clear, and prevention is recognized as at least the main asset and important paradigm shift which is needed to make healthcare systems sustainable. Still, the current investment in prevention is just marginal. It's about 6% of total health expenditure nowadays. And so the idea was really to tackle this major challenge together with, a number of macro trends and challenges that we are facing as modern societies. Of course, the aging of the population is one of such macro trends that we are facing right now, which also places increased demands on healthcare resources. Then this comes also with the chronic disease burden, and at the same time, an unlucky concomitant process, which is the shortage in human resources in healthcare professionals. And we are all experiences in our countries at the same time the difficulty in answering to this complex problem, because we are currently living with a very fragmented healthcare system and with as a side product an increasing number of inequities. So let's go for prevention and let's try to look at prevention really as a paradigm shift, but also as an aspect of health which lives with us from birth to the later stages of our lives, because indeed we can always work on prevention, make prevention ourselves, be the actor of prevention activities with primordial prevention actions, which means identifying underlying conditions leading to causation and then working to prevent the development of risk factors, till later stages with tertiary or even quaternary prevention, which comes in later stage of diseases or in palliative care to prevent complications. So as you understood, the ambition is to leverage on digital technologies at large to support such a change in mindset and paradigm to favor a shift from cure to prevention, from diagnosis and treatment towards prevention, from hospital to communities. And then we established a foundation, which is the hub of this initiative, exactly to promote this vision, and with the mission to become an honest broker in the digital innovation processes behind these huge changes, and building on training, on research, on the triad of training, research, and technology transfer, building on evidence as a guiding star. How you can imagine, of course, that we are moving from data, from digital technologies. So we know how many tools, methodologies that have been already also summarized by Patrick in his presentation, that can help us have a better picture of the state of health trajectories of each individual, but also of communities at large. And so this is the starting point. And so we can really work on very diverse data sets, not just canonical, traditional health data, but also looking from this perspective to, for example, environmental data or climate data. So with the objective to climb the wisdom pyramid, so turning data into value ultimately, so that we can come up with a so-called left shift with respect to the natural history of disease progression, which means have tools to have answers and to have solutions before problems become manifest, before chronicity becomes acute, and working, for example, on the risk factors, which are to a large extent modifiable. So that's the strategy. When it comes to implementation, we have identified and defined a clear digital prevention cycle, which is common to these kind of problems, which means basically we need to be able to quantify. And again, physical activity is, of course, one of the contributors of the information that may be needed also in the area of prevention to quantify the current state of health of an individual and of a community. And then we need to have tools and infrastructure to process sensitive data, maybe even using supercomputing resources in case of large-scale studies or community-based initiatives. This will allow us to have some, risk predictors or tools able to orient then decisions going back to the clinic or to the community. And for example, one of the areas through which this can be performed is, of course, the one of wearables, and physical activity monitoring is definitely relevant to this. And this is a figure taken from a paper which we have currently in publication on NPJ Digital Medicine as a result of the project, which is reflecting on the multiplicity of different wearables, most of which are recording physical activity with different characteristics that we have mapped and we are currently using throughout the country, throughout tens of experimental projects, after having defined some minimal requirements in very different areas, as I will show you in a while, but also in very different age groups, as you see in the lower right of this slide. So including a number of studies in older adults to promote healthy aging, and with a multi-dimensional approach in which physical activity is part of the story, but in which we are aiming to integrate also information on sleep, cardiovascular health, and so far. And so forth. So we aim to become, in a way, some catalyst of innovation in the country, promoting development in these areas. And just a few numbers, because I think time is over, but I will just focus on a few of these numbers. So what we are doing right now, we have ongoing more than 70 pilot experiences in the country, with clinical trials accompanied by a number of digital projects, twin projects in which we are developing, where they are not currently available, specific technological or legal solutions that can help innovation in a way overcoming existing bottlenecks, and proving that digital transformation can be indeed part of the solution and can favor this shift towards prevention. Again, let me focus and comment on this number, 1,445. There are 18 ongoing studies involving physical activity recordings, and 1,445 is the number of equivalent life year that we will have recorded by the end of the project in terms of recording of physical activity. You can already find some of the results in the publications that are already out there, but most of them are, of course, still under production, and the experiments are ongoing. At the same time, we are looking at the acceleration of new initiatives also as startup or spin-off, and indeed there are 25 teams that are taking specific training programs for entrepreneurship and looking at the feasibility to establish new businesses in the area, some of which are also in the area of physical activity and aging. This is a big picture. Again, a number of people that is being involved in the data collection through retrospective or prospective studies is well beyond 2 million people. And finally, just a few examples in the area of healthy aging and ranging from primary to tertiary prevention. So as you can see, we are working on large-scale cohort studies, for example, on determinants, so environmental and occupational determinants of healthy aging, as well as in the prediction and prevention of incident falls or prevention of fractures, and investigating the role of sleep disorders in physical frail sarcopenic and healthy active subjects, and finally also to predict risk of infections and acute adverse events in frequent users of the emergency department, as well as in the strengthening of the telemedicine services with a specific focus on older users. I thank you for your attention. Yeah, you can find contacts of the foundation and the project. So there's a website, a LinkedIn page, and the other social channels. And I thank you for your attention again.